want.
So this is actually live.
inside,
This
you're
is
just
live.
like,
So hi everybody, it's Sunday.
Wait, how do I turn this around?
No, well, there's a button there.
Oh,
Yeah, you got it?
yep, got it.
So hi everybody, this is Sunday, and I'm Dr. Abbasi.
I'm Alyssa Haber.
So Alyssa is starting with us and told me about her experience learning, going through the COVID education and PA school. And lots of things were actually virtual. Why don't you describe it?
Sure, I started my first 6 weeks online. We did that via Zoom. Everything was via Zoom, all of our PowerPoints and our guest speakers. Then we were able to come together online, from online to in person with all of our class, finished out our didactic year that way, and then moved into all the different hospital systems to do clinical rotations.
And since Alyssa practiced on pillows, I thought I'm probably a better simulated patient than a pillow. So she's going to do that OPPPPQR whatever on me, and I'm going to play actually one of my more kind of challenging patient, not one of my easy patients.
Okay. Yeah, I kind of told him that there was a step process on how to take a history, and there's mnemonics, so he was kind of interested. So I'll start with O, which is onset.
So I'm the patient, and I will act like a patient, and you
Okay.
act like a provider. And so, hi doctor, oh my back is so hurting. Oh, I'm happy to see you.
Happy to see you too. I'm so sorry. When did this first begin for you?
Well, I had a so long pain. It's just there forever. Ask my husband. This is always tells, oh, you walk so bad. I'm so everything hurts.
Do you remember the first time you felt this pain? Was it in the last couple of weeks,
I had
months?
pain even when I was teenager. I was in the basketball team, and everybody was having fun, but I didn't have any fun at all.
And has it progressed since you were a teenager? Has it
Oh,
gotten
it's so
worse?
bad. It's so bad. It's so bad. Look at my palms. They're sweaty. They're so sweaty from pain.
Is there anything that makes it better?
I'm not exaggerating. This is actually happened. Well, not some of the aspect of it, not with the same patient, but so.
Is there anything that makes it better for you? What helps you?
Yeah. Percocet make it much better. Percocet.
That sounds about right.
Yeah.
Dilaudid.
Yeah, but I got Percocet used to help, but now I'm allergic to Percocet. The only thing that helps is Demerol, 50 milligrams.
Is there anything that makes it worse for you?
Yeah, like I went to the doctor and I was telling him about my pain. They don't take me seriously. My back is so much hurting.
What did they give you at the doctor? What did they tell you was wrong with you?
Well, the doctor didn't even talk to me, not even for 5 minutes, After 5 minutes, he told me that, I should go and see a physical therapist, but I cannot do it. Every time I go there, my pain gets worse.
Have you seen your physical therapist recently? When's the
Oh
last
yeah, I
time you...
went there twice, and they do interrupt you.
I believe it.
I went there twice, but it was so bad. I just couldn't do it anymore.
Scared to ask the next question.
You stay with the thing, like you didn't get the answer to your first question.
No, I never will probably.
No, you will. You just have to be more persistent than them. You are there. You guide them.
Guide them to the answer?
Yeah.
Yeah.
No,
Okay.
do you want to go the same part at the reverse? You be the
Sure.
patient and I be Dr.
Do you want me to be that dramatic?
Yeah,
Yes.
be dramatic.
Be more dramatic.
Oh,
Oh, be
good.
more
I
dramatic.
have
Yeah.
a severe numbness radiating down my
Relax
leg.
here. I'm here to help you. Listen,
No,
no,
it's
listen.
radiating
I'm going to
right
give
now.
I'm going to give you 5 minutes to relax. I'll be back in 5 minutes once you can relax, and so we can have a conversation. So, I let you go, and 5 minutes later, I give you 5
That's
minutes.
called a
Now
timeout.
That's called
Called
a
a
timeout.
timeout, okay.
If it becomes so unmanageable, you have to give them a little chance to recenter around their problem.
Sure.
you have to guide them. You have to be in charge. You are the captain of this conversation. You have to guide them. And if they can take control of you, then they will make you do what they want you to do. But you have to care for them. You have to take care of them. So I'm back in 5 minutes.
Am I calmed down now?
Yeah, you're more calm down now. So
It's gone.
I'm here for you. I know your pain is real. I have the same thing. I have to ask certain questions in certain way so I can help you.
Okay.
Now, show me. Stand up and show me where that pain is. Right there. Okay.
Right here.
Right there. Now,
It's crippling.
can you please put your thumb on where the pain is?
What if I told you it was okay?
Yeah, I know.
All over.
They do that all the time.
I know they do.
I
It
know
hurts
it's-
everywhere.
I know it's all painful. Try to put your thumb, just your thumb, and I ask them sometimes 4 times, and they still do that. But then I say, I know. You put your thumb where the pain is.
All right, it's right here.
That's right there.
Yep,
Yeah.
right
It is like, may I touch it?
Yep.
Is it right here? Okay. Now, please have a seat. Now,
Okay.
that pain. When did you start? What year did you start having that pain? Give me the year you started.
2006.
2006. Did something happen? Like fall, an accident?
Nope.
You see, you already gave up. You see, by me recentering you,
Nope.
you just couldn't continue that kind of spasmodic conversation that leads us nowhere. I already centered you,
Sure.
and you already are answering me. You already gave me the date. Now, then once I know where the pain is, I go 1 to 10. Are you familiar with that 1 to 10? What's the worst pain you have? Oh, this is all painful.
Yeah, right. It's an 11.
1 to 10. 1 to 10. Is it 12? Okay, then it's 10 plus. We call that 10 plus. That term exists. 10 plus, obviously, there is no pain more than 10. But 10 plus is that you identify it, patient identified as even more than 10.
Right.
Now, where is the pain in your legs?
Runs down the back.
Yeah. No, let's be more specific. We are talking only about the leg pain now. Is it both sides or just the left?
Just the left.
No, even more specific. You're getting somewhere. You're doing a great job. Small little compliment about.
Yeah, you sandwich them.
Yeah.
Doing great.
Is it mostly in the front of the thigh, the side of the thigh, or back of the thigh? And sometimes just put your hands where exactly those dermatomes are. Is any pain, numbness, tingling ever here? Sometimes they say, no, but I had it before. No, I say ever. Not necessarily right now, but is there any pain in the L2, L3, L4, L5, and then you go to the heel side of the foot S1? Do you go dermatomally there and say, is there any pain there?
No pain here.
No pain here. What about the side?
No pain.
What about back of the
Yes.
thigh? Yes.
Yes.
Does it go to your foot?
Nope.
No, it doesn't. Where does it stop? Where's the lowest place?
Back of my knee.
Back of the knee.
Back of the knee.
Mostly L5. Okay, so see, she's already cooperating. She couldn't even
Brilliant.
couldn't pull through with the drama. Let's reverse it then.
Oh, God.
I forgot I was supposed to be dramatic after
You
after
see
my
that?
timeout.
So do they.
Right.
So
I
do
think
they
that's what
forget-
happened.
So do they forget to be dramatic? That is the moment that you establish a relationship
Rapport.
that you can help. Rapport. They trust you now. They don't have to be dramatic to be taken care of. Sometimes they're dramatic because they just don't get any care.
They think they'll get
Yeah. Think about
how
You'll
many
take them more
surgeons-
seriously.
Right.
Yeah,
Surgeons
if
turn them
you are
away.
dramatic, then you get more care. But you have to prove to them they can get the care they need by just giving you the better care. By giving you the
Accurate
information.
answers.
So we just started
Answers
with the,
in
we just
general.
started with
Right.
the O. At 30
Yeah.
minutes we are going to stop, but let's go. You reverse.
You have someone watching.
You want me to do the O?
You have someone watching.
Good. Yeah.
Want me to start back at onset?
Yeah, but now I give you the answer. You center me. I gave you that I have this pain for 5 years. It
5
started
years.
after some moving. I was moving from
Okay.
one house to another. It started that, and then since then I'm just in pain. And the pain, as you just said, is mostly L5
Okay.
on the left side. So let's use your thing.
Okay, next
Version
is
for that.
progression, P. So then you ask him, has the pain remained constant ever since? Does it come
I'm
and
going
go?
to be a notch less dramatic now. Okay.
Okay.
Give you a chance. Okay.
Okay.
So, what? Sorry, can you repeat the question? My hearing is so bad lately.
Has your
ask what my
pain
husband-
worsened in the last 5 years, or
Yeah.
has it remained pretty constant?
No, it hasn't. In the last year, it's getting really worse. Ask my husband. I cannot even do kitchen work. I can't just stand 5 minutes and then the pain, I can't do it anymore. Please help me. Take your hand and then, please help me, please.
I can't even take you serious.
No, but that is it.
I believe
That
that.
is what they really are craving for, somebody to help them finally.
Right.
Because everybody dismissed them.
Right.
And obviously this is a more difficult kind of patient.
Right.
So yeah, but that's a good information. 5 minutes standing, we call that claudication.
Right.
Okay, so move on. Next.
So then you get to the provocative and palliative. So,
Good, that's
it's
the
like,
question.
is there anything that makes it better for you?
When I sit down in my recliner, I cannot even sleep in a regular bed. I have to just be in my recliner. That's the only time I can get some rest. I don't even sleep even 2 hours a night. But that's as well good information, because when you lay back, you're extending. So flexion, actually, same process like when you're holding on a shopping cart and bending over a shopping cart. That means
Space.
that what does that mean? It means foraminal stenosis, meaning that when you're bending forward, the foramen opens, and that's a sign of foraminal stenosis. When you in a recliner or when you shopping carts and when you're going to Walmart, you have to bend over, lean on the shopping cart. So we are getting somewhere.
We're getting somewhere.
Yeah.
So then you move to provocative. So it's like, so what makes it worse? What are some activities that
Standing,
exacerbate?
walking, living make it worse, doctor. Living make it worse. And so any activity.
Any activity.
Any activity make it worse. So some element of axial lower back pain with the bad
Sure.
disc and so on. Oh, I think some animal is coming. So go ahead.
Sure.
You got the provocative test already.
Yeah.
So what else?
And then next is Q, so quality. So then you say, can you describe the pain that you're feeling in your own words?
It is just this pain everywhere in the back, but sometimes it just shoots down back of my thigh as I described to you, going down to back of my knee. But most of the time, just this deep ache.
Sure. And then deep ache, and then sharp shooting, kind of the descriptive terms of it, which we had gotten previously.
yeah.
But
This pain that goes down the back of the thigh, what do we call it?
what?
The pain that goes back of the thigh to the knee. But there's a name for that. We call that radiculopathy.
Oh, yep,
Yeah.
yep. That comes from
And
the
then
back.
next
so.
thing you ask if as well, you have as well numbness and tingling there?
Yep, loss of sensations.
Yeah, sensory.
Anything like that.
What else? Go to the next P.
We're past P. We went to Q. R,
Oh.
R, which we had radiate or region, the area. So then you would ask them, okay, so where does the pain, start? Which you kind of described the thumb. Where does it start? Where does it end? Which we got. And then rating. So R on a scale of 1 to 10.
Oh, it's 25, doctor. My pain is 25. It's so bad. It's I cannot do this anymore.
Which is always good to have that documented. So when they come back and you say, how's your pain on a scale of 1 to 10? Well, 2 months ago it was 25, and now we're down to
And that's a good idea.
a 2.
You
Look
got
at
it.
the-
I give you lots of credit for that. Everything we do is about, because for a good reason, and they should. They forget their pain.
Right.
We don't want them to remember that.
Well,
We are there for that, but they come back. Literally, this truly happened to me. I'm an 89-year-old patient, and I got even testimonial of that patient. Comes to my follow-up, and he's so upset with me, that I broke all my promises and so on and so forth. So how bad is the pain in the back? Well, 4 or 5. How bad is the pain in the leg? No pain in the leg anymore. How bad was it? I don't remember. I looked it up, 10 plus. So what is not working for you? Well, long story short, every year he goes bikes with his 84-year-old bride to Sturgis
Okay.
for motorcycle, 600 miles. He just couldn't do it this year. He just couldn't this year go on a few hundred miles trip on a motorcycle with this, but he was living for that. He couldn't do that. So everything else that he's back then from 10 plus went to 3 and 4, leg pain was gone, activities increasing, he's walking. All of that was not really important enough to him.
He wanted.
So in his eyes, I failed until I showed where he was and how far
Sure.
we have come.
Yep.
That's why we document that.
Yep.
What I did, I didn't argue with him and so on. I said, you're right. I don't remember it either. I opened up the note from previous, before the surgery, and I went through my documentation.
With them.
I said, yeah, at that time you said your pain was like 10 plus meaning you told me it's more than 10. How bad is now that? And then all of a sudden he's a little more quiet. Then next step, you told me that time that you had pain in the side and but here, right here, I touched you there. How is that? No, you're right. I don't have that anymore. And then you just put
Outlines
manage
and
at that
all
point become an expectation management, which is extremely important part of the physical exam and doctor-patient relationship. What is realistic? Can I make you 20 years younger? Oh, you would be 5
You
years
can
old.
try.
Yeah, you would be 5 years old. I can, but I can make you. When the realistic expectations are established, that's where you can really help the patient. So, where are we? We're almost done. here.
QRT
T, what's
or
T?
S is severity, which we kind of did that. T
Yeah.
is treatment. So then you ask them, what have you done at home for this? How do you manage your pain?
Oh, my
And
husband gives me all these massages. I love it. It helps so good.
What a lovely husband. I need one of those.
Right.
Yeah.
Where do you buy those?
Yeah, right. So then, yeah, I have the desk.
And then, and they tell you lots of things that may or may not be really relevant, but you give them a lot of opportunity as long as they're not far beside, like, I don't want to know that about the vacation with their daughter
Right.
in Bahamas because my next patient is waiting already in the next one.
Yeah, right.
But sometimes if you give them opportunity, so the first 5 minutes, I just let them go. They have so many
Unloading.
things. Yeah, they have so many things. The first 5 minutes, as long as they give me some information, like it's not like just a waste of their time, I let them go. If they're really dramatic, less than a dozen of time in my career, I did leave the room and said, I know you need a minute. I will be back. You just stay here, calm down, and I will be back. But that I have done less than a dozen of time. But most of the time, the first 5 minutes or first 3 minutes, you just let them go at it. You just nod, have a they smile, they confirm their stuff, and you just let them go.
Right.
But after that, you have to weigh in and guide the rest of it.
Sure.
And then at that point, that certainly, the important thing, what have you done? Physical therapy. How many times? When was the last time? Injection. What kind of injection? When?
And how many?
Surgeries. What kind of surgeries? When? Most of the time they cannot tell you much about it, but you give them opportunity because they are the best source of information for you. So, treatment.
Yep.
Yeah, this as well happened.
Okay.
I went to Sioux Falls. That doctor didn't barely talk to me. And then he operated on me. He made everything worse. Everything worse. Do you think he did the wrong thing? Do you think he did the wrong thing? What do you say in a situation like that?
Well, you would never downplay a doctor and their decisions, but you would,
You just say, I don't know.
yeah, right. I'm
Because you don't
unsure
know.
of, the decisions they made or what you talked about.
But let's
and
talk
what we
about
came
how
down
I
to
can
it.
help you. Let's not
Right.
talk about that doctor. Let's talk about how I can help you. What can I do for now? But you do need to know what did they do, and what kind of procedure they did, how was it before, how was it after, but
Right.
you don't ever get into another surgeon or another doctor did something wrong because you just don't know.
Right.
And
Nope,
even
it's not that.
and even if we truly think somebody maybe did something wrong, the patient is not there for legal advice. The patient is there for medical advice.
Improvements. Yeah.
So and they trying to proliferate, and lots of our colleagues do it the wrong way. the first thing they say that how the wrong other surgeon, other doctors did. And that is the worst way to establish a rapport with the patient. And that is like trying to be better than other doctors, and that's how to get the trust of the patient. It always backfires. Okay, and still lots of our colleagues do that, but we don't. We just say, I don't know, I will get the information regarding the treatment, so if you are not sure, you don't have to. And but let's concentrate about how I can help you. Okay, and most of the time they understand and they move on.
Sure.
So I guess we are done with that. No.
We got A.
A,
but
what is that A?
It's associated symptoms. So like in this case, like any foot drop, and then you get down to like numbness, tingling.
Then you get to the exam, right?
Yep, and then you get to the physical
Yeah, I
exam.
get nauseous. I get always nauseous when I get the medication. Everything makes me nauseous except Demerol.
Of course.
You guys know what Demerol is?
I can make an assumption.
It's a narcotic
Narcotics.
that it peaks very fast. It's very hydrophobic. No, hydrophobic. Because
Goes in
hydrophobic means
through the liquid.
lipophilic.
Yeah.
Right.
Meaning that lipophilic
Go
means
through the
meaning
membranes.
they go easier through the membranes and
Faster.
they peak
Quicker,
up much
right.
faster. And when they pick up faster, they give you
Effect.
the euphoria.
Euphoria. Yep.
So, and
Makes you feel great.
so for
Very
a while it was used to be that the hallmark of something that red flag, that if somebody comes and the only thing that works for that person is Demerol, 50 milligram, you know the milligram,
I know.
then your thing goes up.
Yeah, your red flags.
goes
You
up. Yeah.
just a little more cautious. Yeah.
Yeah, I saw a TikTok of someone and they're like, well, Percocet doesn't work for me, but I've never tried, and they listed some other one,
Yeah,
like
yeah.
something
No,
that some patient was
sometimes
saying.
these
Tramadol.
patients become very knowledgeable about
Who
their
knows?
problem, and they have to. I mean, if
Tramadol's
if they have to live with that all the time, they become. You would be surprised how at the expert they know about their problem, not necessarily they cannot do surgery on themselves. Though this is true. I once had a patient who knew that he has a cyst. He had a facet cyst, synovial cyst, and he tried to put something in
Pin
that,
or something to pop it.
and I think obviously he failed. He didn't understand that how delicate those things are and how deep that is. But he tried that. He was a farmer, by the way.
Yeah, sounds
He
right.
would
Yeah.
be.
He sounds about
Yeah.
right. They don't have time
He
to
went
sit.
to his garage and tried with a mirror and a nail because he read on a that's a TikTok
Some
actually.
forum, like
That's a
some Reddit
TikTok.
forum, probably.
That he tried to drain a facet cyst
It
in
would
his
come
garage.
right back.
Huh?
Wouldn't it come right back if he drains
No,
it?
he didn't.
You can't even
No, if he
access
were to
it.
pop it,
No.
it would just come right back.
So most of the facet cysts are inside of the spinal
Right.
canal.
So you
meaning
couldn't
that
even get to
no,
it.
You can't
you
access
cannot,
it.
you cannot
Not-
drain it with a needle in the mirror. Doesn't matter how dedicated farmer you are.
Do you think like if he hit like his spinal cord or anything, he would
Oh,
maybe like
yes.
faint
No,
from
get
the
a
he
shock.
cannot.
He
He cannot go that deep. Nobody can take. Our body has its mechanism to prevent
Protect.
us
Look at this
doing
little
certain
brat.
things. Yeah. Well, thank you so much for attending this. This was educational for me,
you.
and I'm hoping for everybody else. Okay, but we should do more often things like that, because I think,
So what is the
especially if
acronym
you are in the medical
Mnemonic.
field,
The pneumonia.
this has some learning experience. It provides some learning experience for you. Thank you so much. You can. But I should tell that story
What
of
is
the
the
farmer
mnemonic
on
again?
TikTok.
The pneumonia.